Yeah. Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the prevention of heart diseases. There are several heart diseases in the community, though treated may leave a disability or problem to the patient or may recur. So prevention is the utmost important. There are some dreadful diseases like massive myocardial infarction which may cause death before the patient seeks medical help. There are many heart problems, types of heart diseases which are discussed in concerned articles. Ischemic heart disease prevention. It is a coronary artery disease. The people with a possible access to coronary heart disease with a number of high risk factors should be advised to modify their life pattern. Advised to stop smoking and control obesity and anemia. Hypertension, hyperlipidemia, diabetes must be corrected. Women at high risk should not use contraceptive pills. These diseases are cardiovascular diseases CVD are discussed elaborately in the heading ischemic heart disease and myocardial infarction. The main is the coronary artery disease with symptoms of heart disease, symptoms of heart problem, heart attack, symptoms of heart attack. Heart attack symptoms include heart pain, dyspnea, sweating, etc. Exercise. Every form of muscular contraction uses calories and regular daily exercise promotes loss of weight in obese. But exercise tolerance improves only if physical activity is sufficiently vigorous to cause tachycardia and dyspnea. This is beneficial even when carried out for a short period. Pain, undue dyspnea and fatigue must be avoided. Congenital heart disease. The cause is not very clear, but the heredity is also may not be a cause as they won't run in families. With the problems of heart valves, there could be heart failure, congestive heart failure, other symptoms of heart problem are there, which are discussed in the article concerned with the heart valvular defects. Rubella, contracted by mother during second or third month of pregnancy, is frequently followed by the development of congenital heart disease in child. It can be prevented by vaccination of young girls in their early teens with the rubella vaccine. Rheumatic heart disease prevention. Care must be taken when there is a strep throat or scarlet fever to prevent the relapse, as the relapse may lead to the more damage to the heart, causing mitral or aortic stenosis. Fever in children with large swelling of knees or any large joint should be taken care of by thorough examination. Relapse may be prevented by giving a small dose of oral penicillin, phenoxymethylpenicillin 125 mg twice daily. If sensitive to it, sulfadimidine 0.5 grams daily may be given. Infective endocarditis prognosis. In case of early diagnosis, the infection can be eliminated in 90% of cases by giving adequate antibiotics. If diagnosis is delayed, the underlying cardiac diseases may progress and the prognosis is bad. Prevention. For patients who have congenital or rheumatic heart disease and are about to have tonsillectomy or extraction of tooth, should be given a cover of penicillin to prevent endocarditis. Prompt treatment of all infections is also important. Cardiac syphilis. Treatment to gonorrhea may mask the symptoms of syphilis through treatment of all cases. Education of people to recognize the risk of neglecting the facilities for treatment which are available in all large centers, and social efforts to combat the cause which results in the spread of venereal diseases are the means which will prevent cardiovascular syphilis. This means that the patient with a venereal disease, that is purulent discharge, must be scanned for syphilis and other sexually transmitted diseases. Thyrotoxic heart disease. In thyrotoxicosis, cardiac complications can be avoided by early diagnosis and treatment. Hypertension and atherosclerosis. The hypertension and atherosclerosis are interrelated and may lead to myocardial infarction or paralysis. These are usually runs in families, means genetic, may start in obese or sedentary working, or with occupation with mental strain, etc. The people before 50 years of age should avoid smoking, excess alcoholism, sedentary work, tension, etc. Above 50 people should have a periodical complete checkup every year, and with hypertension should have checkup every 6 months. Should avoid salt, alcohol, smoking strictly. That's all about the heart diseases and prevention, and in the next video I will discuss about some other disease. Thank you.